Geez, in an hour.
3:20 p.m. Bull session. Subject, the future of Dr. Mulder. Problem, Dr. Mulder wants to specialize in surgery. His colleagues favor internal medicine.
Yeah, but this is an acute hospital. What do you get on the outside? You know, you can't treat pulmonary edema in the home very well.
Well, if you're going to be an internist and, you know, out in practice, you're right. You're going to be treating a lot of people with nervous stomachs. Now, what do you think you're going to be treating as a surgeon out in practice?
All right, stasis dermatitis and varicose veins. But you can do something.
A few toe ulcers,
right.
Ingrown toenails.
Right.
I've got 3 moles on my neck that I've been trying to get some surgeon to remove for a couple of years now. And that's the kind of stuff you're going to be doing.
Yeah, but you do it, and you know it's over with.
And you take out that mole and remove that ingrown toenail. And the patient is suffering, and you've cured him.
Right.
But how much challenge is there in removing an ingrown toenail?
Okay, but then limit it to a surgical specialty, too. Stop being a general surgeon and get to be, let's say, a cardiac surgeon.
A cardiac surgeon, of which there are how many in the country?
Well, all right.
Okay.
But I mean, so...
And talk about 5 years climbing up the ladder. That's about 25 years climbing up the ladder.
But you're learning all the time, and you get to do things there.
Sure, you get to open and close.
Yeah.
And I'm not talking about opening and closing the heart valves.
But the woman with, you know, that comes in with a nervous stomach, how much sifting do you have to do to see a real disease? This is the hooker, always, right? Surgical.
It's not really so much what you see. It's what you figure as you're seeing it. It's the figuring out that's interesting. It's not so much what you end up with that is.
Yeah.
Any A4 doctor, emergency ward stat. Any A4 doctor, emergency ward stat.
Mulder, that's for you. You're up next.
The patient is a middle-aged man suspected of having swallowed an overdose of paraldehyde, a potent sedative.
I get panicky, man.
The doctor is here.
When did you fall down? Have you been drinking? A couple. Where'd you get the medicine from that you drank?
The doctor is Dr. Mulder, Miss Mulder. He's examining his son at the moment and really couldn't be of too much help until the examination is finished.
Oh, dear.
Well, if you get an EKG, I'll get a lumbar puncture.
Okay.
Would you give me a spinal tap set? We're going to have to take you up to X-ray and have them take some X-ray pictures of your head.
It doesn't.
No, I know it doesn't hurt, but I just want to make sure that you haven't got any fractures up there. Okay? I'm going to call your mother now and tell her where you are and that you're all right.
No, I'll go home.
No, you're not going home. You're going to stay with us for a while. Is Mrs. Well there? Well, this is Dr. Mulder calling about your son who's admitted here at Bellevue Hospital. He can't tell us too much. He's apparently been out drinking. Why does he carry paraldehyde? Yeah, well, we have reason to believe that he fell down either a flight of stairs or a few steps. on, Mrs. Lowe.
If they get it.
5:12 p.m. 25 hours remain on this tour of duty. If luck and the admitting office permit, Dr. Mulder might make it to supper, or even catch an hour's sleep. But it seldom happens. And so, it's 36 hours on, 8 hours off, $81 every other week, about 40 cents an hour, week in, week out. The intern's life for 1 year.
Just breathe normally now. Okay, you want to lie down for me for just a minute? Any chest pain at all?
What's up?
Cough?
Occasionally, quite a bit, you know, from...
I think what we'll do is send you up in the ward and do a couple more tests and take care of things up there rather than leave you down here tonight. We'll transfer you up there.
The patient has a serious disease. Blood clots have collected in the vessels of his lungs, making it difficult for him to breathe. The cause is unknown.
Well, what are you going to do with the man?
Well, I told him we just weren't sure at this point. His EKG hasn't changed that much, and his chest film...
What to do is the problem. A tough one, which finally must be resolved by the Chief of Service.
He was admitted here because mainly of increasing dyspnea on exertion.
Tests show that the blood clots in his lungs are somehow formed in his legs.
What do you want to do?
Dr. Reagan advises an operation. Dr. Mulder must tell
I
him.
think probably this is, if he has had recurrent pulmonary.
You know, there are some things that we could do for you. There are some procedures available that we feel would help you greatly. Well, one of these involves surgery. Let me draw this out for you. Maybe it'll be a little clearer if I sit down and just sketch this out very quickly. I'm not much of an artist, but we'll see how this goes. At this point is your heart. I'll just draw it as a square, and there's a valve here, and there's another part of it right here. And these send out the pulmonary arteries that go to your lungs. So the blood comes up here, goes through here into a receiving chamber, then into a pumping chamber, and out to your lungs, to both lungs. Now, a blood clot follows exactly the same course. It's down here in the veins in your leg, it breaks off, goes up here. This is a gradually increasing tube in size, and so there's no opposition. Let me explain the operation to you first. What it's called is an inferior vena cava ligation. Now, it involves opening up your abdomen and getting the vein free and then putting a tie around it securely. What this does effectively then is prevents any blood clots which come up from there from getting up to your heart and from your heart eventually into your lungs. And this is what we feel is the best that we have to offer for you at this point.
Well, judging everything as it stands right now, I don't feel I'm in a position to give a yes on it. I wouldn't want to consider it right now.
Why not? Can you tell me why?
Well, I don't have any fear of the operation. My main concern is for my legs in the future. The overtaxing of the smaller veins or arteries in the legs eventually may lead to my being in a wheeling chair or something like that.
Right. I can't guarantee you, it's impossible to do that in medicine, but a lot of people have had this procedure with minimal difficulty, really. And it's sort of an investment, really, is almost the way you have to look at it. And you have to look at the returns that you'll get out of it. There's a gamble involved. I'd be foolish and lying if I told you that there wasn't.
But nothing for tomorrow or next week or next month.
Right.
It offers me nothing then.
Well, we want you to understand that there may come a point at which we won't be able to operate on you anymore. A time when this procedure will not be available to you always, and we feel the time is now. The only thing is that we wanted to talk to you to let you know what is available now and what we could possibly do for you now, and perhaps tell you a little bit of what may happen in the future.
I appreciate your interest.